thought it was time for a new video to appear on the blog. So here I am. It's Monday. That means last night was the 8CSM or HCSM chat. The chat started off well. We were delving into future possibilities for the use of social media to address certain health issues, whether they be on a mass level or individual patients level. And we touched on privacy issues, we touched on de-identification issues, and it was a very viral and fast-paced chat. And unless you're adept at tweet chat, you were probably lost in the shuffle. However, later in the talk, we started to delve into what I'll call specialty items, such as e-cards and everything else. And it just got me thinking in terms of the fact that I talk to a lot of physicians and a lot of patients almost on a daily basis about social media and healthcare, and how the two can embrace one another so that the ultimate goal is to improve the information that you receive and ultimately the choices that you receive, and hopefully the healthy choices you make, and therefore making you a little bit healthier, which I guess is the end game and the end goal of HCSM and healthcare and social media. What I wanted to touch on was, and what I started to think about during this chat, is the fact that so many of us talk about different tools and different platforms. We don't really talk about different operating systems, but that always comes up when I'm talking to physicians or groups about how to establish a digital footprint and a presence in social media, period. Some of those people are looking to establish a marketing presence. Some of those, such as myself, have a more altruistic approach or paternalistic approach, where we're actually trying to teach and educate you. However, they always ask, what type of computer should I buy, etc. I think I saw something on Twitter on this subject this past week. I apologize because I don't know who to attribute it to. However, the tools are simple and non-specific. I think it's a presence in social media is certainly operating system agnostic. It doesn't matter what system you utilize. I'm talking to you on a Windows PC. Yet because my hospital blocks everything, I have an Apple PC on a Wi-Fi network, not associated with my office. And when I want to be mobile, I have my iPad to go with me as well. If those fail, we have the BlackBerry, which is tethered to the hospital mainframe, and therefore we want to keep certain messages off that, and then the ubiquitous iPhone. So, oh my God. So you can utilize any operating system, Android, Internet Explorer, Windows, Mac, it doesn't matter. The mere fact that you're thinking about it and that you're online, how you get there is absolutely irrelevant. I think the more important discussion, though, is which platforms are you going to consider utilizing? There are hundreds and hundreds of platforms, and the more time I spend on Quora, the more I realize that I've missed a number of new platforms that have emerged over the past week. Well, the platforms that I think are important are Facebook, Twitter, a blogging platform, and your own website. Right now, the beginning, nothing else. Why? There are very few physicians and healthcare professionals on social media. There are very few healthcare professionals who are curating content and displaying that content in various social media circles. There are very few who are doing anything but lurking on their Windows, Apple's, or Android platform. So the first thing that we need to do is get people interested, get people on board, get people engaged. The easiest way to do that is to stick with the two key platforms, Facebook and Twitter. That way they know what we're saying online. They can easily choose and follow us. I think Twitter is where you make friends. Facebook is where you interact with those friends on perhaps a deeper level. I'm not exactly sure that's fully accurate, but you seem to more easily make friends on Twitter than on Facebook. For those of you truly interested in entering the intersection of healthcare and social media, either a website with truly dynamic content, which almost emulates how a blog would behave, is an absolute must. Deep Web 2.0 integration is an absolute must. And for those of you who simply want to put out a few tidbits every day, and perhaps a blog on a WordPress platform is what's most appropriate. So let's follow the KISS principle here. Let's keep it really simple, because those of us that are just joining us and are joining us every week, they're thinking about how to get into this, and if we're talking about too many platforms and too many avenues and too many startups, of course, most of which aren't going to be here in a few months, then we're just going to confuse them, and most important, we're going to scare them away. So let's teach them first how to engage, how to lurk, how to listen, and what the principles are behind the Hickson Group and why we exist. I sort of answered the why in a post a few weeks ago, and this is more on the how, and perhaps the next post will be something about where. I look forward to seeing you again soon. Take care. Bye.